Okay, gosh. Um, I think we'll go ahead and get started. I'll let people know there's still chairs up front. It's just like going to church, there are still room at the front. As everyone gets settled, I want to say thank you to the people who came and welcome. We'd like to explain that this is a dedication that is for 3 separate events. This is a dedication for the new behavioral health unit, for the Jan Again Resource Center, and for the Dr. Mark Peltan statue that is over to our right here. So to start things off, my name is Dr. Teresa Mock. I'm a Senior Vice President at Mercy One Hospital here. And I have the privilege of being over the Behavioral Health Services Department. I'd like to first introduce Rod Schlater, who's our interim president of Mercy One North Iowa, to start the proceedings for the day.
Hopefully you can hear me, can't you? Good. Well, thank you, Dr. Mock. I appreciate it. And thank you for being here. It's a great turnout. And I hope you're as excited as I am about our new center here, which is fantastic. Thanks all of you for touring. It's really going to make a difference in patient care here in North Iowa. So I'm tasked with introducing some guests. Amanda Reagan is here with us, who's in the Iowa Senate. So Amanda's right there. Thanks for being here, Amanda. And I also get to thank some folks. I get to thank Hinkle Construction. Our construction company is part of this. Our architects were out of Des Moines, BWDR, and our engineer was out of Des Moines also, RDG, helped us with the construction. I also want to call out Dan Barnum, who's the previous CEO here at Mercy One, and he was instrumental in getting this project off the ground and getting it approved through the various approvals, which is no small task. So I really want to thank him for doing this. And I really want to personally thank Dr. Mock, Teresa Mock. She's been a great leader on this project and lots of ideas and energy. And you can see the result of her hard work. And I know she'll be thanking others later. So many of us remember Dr. Mark Peltan, who was instrumental in starting our behavioral health service in North Iowa. His family and friends have donated this great statue, lighting the way at the entry to the Behavioral Health Center in his memory. Now it's my pleasure to introduce Dr. Brent Seaton, his friend and colleague, here to say a few words. Thanks.
You guys hear me okay? All right. So I am Brent Seaton. I'm a neuropsychologist. I've been here almost 20 years, and I'm honored to have been asked by Barbara Pelton to speak today about Dr. Mark Pelton during this dedication ceremony. Dr. Pelton was raised in Philadelphia. He graduated from Penn State and then completed a master's degree at Villanova prior to finishing his doctorate in clinical psychology at the University of Wyoming. After a brief stint at the Mental Health Center of North Iowa, he became the director of Mercy Behavioral Services in 1983. Just yesterday, we had the blessing of moving into our new space, the Outpatient Behavioral Health Wing, which includes space for numerous clinicians and support staff. When Dr. Pelton came to Mercy One, the department was an office and 2 employees, including himself. During the course of his time at Mercy One, Dr. Pelton grew the outpatient program into the preeminent provider of behavioral services in North Iowa. And he integrated those services within the inpatient setting and throughout the Mercy One system. He was an excellent psychologist, a busy, focused, and accomplished department director, and a pragmatic leader as a member of the State Human Services Committee. Dr. Pelton was our director. He was our go-to person for knowledge and reason, and he was our support person, all at the same time. Barbara shared with me that the statue, lighting the way, was crafted to symbolize what the artist Lori Aycott had learned about Dr. Pelton from personal account shared by family, friends, and colleagues. The symbolism captured by Ms. Acott could not be more appropriate. When I was beginning my career in neuropsychology, there was always Dr. Peltan lighting the way. For new clinicians entering the challenging field of mental health, there was Dr. Peltan lighting the way. For the countless parents trying to understand and help their children with emotional struggles, there was Dr. Peltan lighting the way. For a department dealing with the challenges brought by managed care and government-mandated austerity, there was always Director Peltan lighting the way. He supported, he mentored, he healed, and he guided our way. And then, on March 10th, 2015, he passed, and everything went dark. Or so it seemed. Because of all things I have experienced, the darkness of loss and grief shades perception most heavily. It is during those times that we continue to move forward, or we try to, searching for something to help us through the darkness. And for me, once again, I found Dr. Peltan lighting the way. Every day I see his light when I witness Alice O'Toole providing the best service possible to patients and colleagues. I see his light in the amazing work that Rose Brandner has done as his successor as Director of Behavioral Services. I see Dr. Peltan's light in his family, his amazing wife, children, and grandchildren. And most pertinent to why we are here today, I have seen Dr. Peltan's light in the work of Rose, Dr. Mock, Joellen Stile, Tim Mason, Dr. Lacis, Dr. Ramos, our nurses, our therapists, and the numerous other colleagues central to making the Behavioral Health Center happen. Behavioral Health Center is a culmination of the hard work of many people. The statue, lighting the way, stands as a representation of the central role Dr. Peltan has played in the creation of the Behavioral Health Center and the way he will continue to light our way as we move forward. I'd like to end by just reading a little excerpt from the book, Jacob's Ladder. This is something Mark Coffin did at our meetings. It's entitled Sunrise, Sunset. It was early twilight. Ruth stood next to Jacob at the foot of the fields that ran to the mountains. Giant rolls of hay, still covered for the winter, punctuated the expanse. For a long time, they sat silently, enjoying the simple pleasure of each other's company under the open sky. Jacob, thought Ruth out loud, have you noticed how it sometimes is difficult to distinguish between the sky at sunrise and sunset? Yes, said Jacob. And your sky, Jacob, is it at sunrise or sunset? Both, said Jacob. How is that possible? Jonah will be leaving soon, said Jacob, listening to the sadness in his own voice. Jonah's sun is rising. My time with him is setting. I believe, said Ruth, taking Jacob's hand in hers, that you will be in every sunrise of Jonah's life. And I believe, said Jacob, looking into the sky reflected in Ruth's eyes, that you are the sun rising in my life. Thank you.
Good job.
Thank you, Brent. You know, the behavioral health unit was a dream of Dr. Pelton's, and I'm sure right now that he would have a huge smile on his face looking down at what we've done. I'd next like to introduce Wally Smeeby.